Hello, today's presentation will be regarding the curriculum evaluation of Higher Education University School of Nursing. A moment and pause here to review the table of contents. Take a moment to introduce our group. My name is Sarah. I'm joined by Lisa and Callie. The three of us are master's students at the University of West Georgia. This presentation provides a comprehensive analysis and critical evaluation of the Higher Education University nursing program curriculum in alignment with established accreditation standards. We aim to demonstrate our proficiency in applying foundational principles of curriculum development and educational frameworks while also considering pertinent social, political, and technological influences that impact nursing education. Through this evaluation, we emphasize the importance of a robust and contemporary curriculum that meets accrediting requirements and prepares nursing professionals for the complexities of the healthcare environment. Higher Education University, or HEU SON, is a fictitious private liberal arts institution offering a pre-licensure nursing program. The institution has strong ties to local healthcare systems and influential community stakeholders. The university and its nursing program emphasize compassion, diversity, critical thinking, and holistic care, aiming to produce well-rounded caring professionals prepared to lead in a global society.
According to Belita et al. 2020, stakeholder engagement is crucial to curriculum development because it fosters innovation and helps maintain effective, up-to-date care. Two critical stakeholders in the program's success are the pre-licensure students enrolled in the HEU SON and the community's healthcare systems. Engaging students in curriculum development can strengthen student-faculty relationships. These relationships create a positive learning environment and encourage faculty to enhance the teaching strategies, which promotes learning. Facility involvement in curriculum design ensures that the curriculum focuses on knowledge and skills needed to prepare students to give the care required in an ever-changing healthcare field. Caring science can strengthen relationships with program stakeholders. Watson discussed the 10 charitas, or processes by which we should live. The fourth character is the concept of nurture. Nurturing means developing and sustaining loving, trusting, and caring relationships, and that's from Watson, 1979. This can apply to the relationships between the programs and the stakeholders. Relationships will be strengthened by having open communication and including input from both students and facilities. Strong relationships help to create safe environments for learning.
The university's values listed here are evident throughout their vision, mission, and philosophy. Similarly, these values are woven into the nursing program's philosophy and mission. All are centered on students and staff achieving academic, professional, and personal goals with excellence. The nursing program philosophy addresses both the art and science of nursing. It strives to prepare future nurses who are caring and compassionate while also having the necessary skills to provide quality care. This mirrors the program's mission, which is centered around preparation. Contributing excellence to the field of nursing is at the heart of the program's core values. Incorporated into the curriculum, the mission and philosophy offer a solid framework that works toward the goal of providing excellent quality care. The philosophy and mission also address the importance of critical thinking that leads to clinical judgment while emphasizing compassion in care. The alignment of the institution and program philosophies at Higher Education University creates a collaborative and strong vision for its students and staff. The similarities between the university and program philosophies function as a strength. As students learn to function within the university philosophy throughout their first 2 years of schooling, the same core values are incorporated into the nursing program. The university philosophy promotes student and staff success through knowledge, compassion, caring, and creativity. The students are then prepared to further their academic endeavors with discipline-specific learning goals. You will see the nursing program's original program philosophy written here. The original philosophy is well written and addresses nursing as a whole as well as the faculty's role as facilitator. The values and goals mirror the university mission as well, providing cohesiveness throughout the educational journey. However, one component that the philosophy does not address is evidence-based practice. Adding it to the program's philosophy offers a stronger foundation and highlights the importance of evidence-based care. As nursing continues to promote evidence-based practice, initiatives driving this focus are implemented in both education and healthcare organizations. The revised School of Nursing philosophy would state that excellence in caring is achieved through focused course outcomes and clinical practice, leading students to the ability to provide evidence-based quality nursing care. Listed here, you will see the essentials of baccalaureate education for professional nursing practice. These professional standards are used at Higher Education University's School of Nursing. Published by the American Association of Colleges of Nurses, these standards offer a framework for nursing education. With quality care for all populations as a priority, a program based on these standards offers nursing students a strong foundation for becoming influential and effective nurses. These standards are appropriate for the university's nursing program. They prioritize quality care, patient safety, patient care technology, healthcare policy, interprofessional collaboration, health outcomes, prevention, and professionalism. These standards are also woven throughout the School of Nursing's philosophy, mission, and program outcomes. The program outcomes are listed here and focus on building future nurses who act as leaders in their field, advocates for their patients, and collaboration among multiple disciplines towards safe, quality, and evidence-based care. The alignment between the program's philosophy, mission, and outcomes is evident. The values listed as drivers of the program's philosophy are also woven throughout the curriculum outcomes. This alignment is a strength in curriculum design and provides a cohesive experience for both students and faculty. Also, the American Association of Colleges of Nursing professional standards are incorporated into the program outcomes as well. The third program outcome addresses interdisciplinary care. This outcome could be revised to highlight the nurse as a leader who promotes interdisciplinary collaboration. Teamwork among disciplines benefits patients as well as organizations, as effective interdisciplinary collaboration positively affects innovation, process improvement, performance, and employee engagement. The program outcome could be revised as stated above to promote and lead interdisciplinary collaboration to meet the health goals of diverse populations across the lifespan.
The HEU SON BSN program follows a concept-based curriculum design. Concept-based curriculum design focuses on teaching core principles and ideas central to the nursing practice. All transferable concepts are taught rather than focusing on isolated facts, and that's Almari et al. 2024. A strength of the concept-based curriculum design is that it allows students to strengthen their critical thinking skills to provide patient-centered care, and that's from Romanowski et al. 2019. Students think more critically about new topics and situations by applying prior knowledge and experience. Knowledge and skills build as a student completes the program. One weakness of a concept-based curriculum design is the challenge of implementing this type of curriculum. Many concepts in nursing may challenge nurse educators to decide which concepts to incorporate, and that's Brassau et al. 2019. One strength of the HEU SON program's curriculum is the ability for students to personalize their learning with elective courses. During the second, third, and fourth semester, students can choose a 3-hour course in the area of interest. This allows students to personalize their learning experience, motivates them, decreases achievement gaps, and increases the efficiency of education, and that's Teslaff et al. 2021. One weakness of the program's curriculum is the absence of hidden curriculum. The HEU SON has no prerequisite for medical experience for entrance into the BSN program. There are implications of a hidden curriculum in this design. Students are expected to know how to function efficiently in a healthcare environment without prior knowledge or experience. The absence of a hidden curriculum can lead to students struggling with formal curriculum since there are no requirements for prior healthcare experience or knowledge. And that's from Hosseini et al. 2023. The BSN program could incorporate a hidden curriculum by requiring applying students to have a certified nursing assistant or CNA certification or have worked in a healthcare field before. This can ease the transition from nursing school to practice. The HEU SON is accredited by the Commission on Collegiate Nursing Education, or the CCNE. The CCNE aims to improve public health by assessing and identifying nursing programs that engage in effective educational practice. And that's from the CCNE 2024. The CCNE accreditation influences the program's curriculum because specific topics, such as care for diverse populations and interprofessional collaboration, must be included in the curriculum to be accredited. The curriculum must be logically sequenced with teaching learning strategies that support the achievements of student outcomes and include clinical practice that will help learners use knowledge in their care. And that's from the CCNE 2024. This is an appropriate accreditation for the HEU SON. The accreditation standard in the HEU SON evaluation plan is the CCN Standard 3, which is Curriculum and Teaching Learning Practices. This standard ensures that the curriculum is developed with the program's missions, goals, and student outcomes in mind. The curriculum also reflects the professional nursing standards, the BSN Essentials. There is also the inclusion of caring for diverse populations to meet the community's needs and interprofessional collaboration. The facility undergoes a peer review of teaching every 3 years and every 2 years by the program director. The facility completes written course summaries every semester to review the semester's content and teaching strategies. The curriculum includes classroom, lab, and clinical-based teaching. By offering a wide variety of teaching strategies and evaluation methods, the environment of learning can foster achievement of expected student outcomes. However, the program is not quite ready for an accreditation site visit. The last revision of the curriculum occurred in 2015, which was 10 years ago. One recommendation for improvement is to update the curriculum more often. It is written in the evaluation plan that formal curriculum committee forms and reviews the curriculum every 6 years. However, according to the CCNE, the curriculum should be reviewed and updated every 5 years. The HEU SON could ensure the quality of teaching by providing more frequent reviews. Faculty could undertake a peer review once a semester and the program director every year. This could ensure that the curriculum, teaching strategies, and evaluation methods are effectively being used.
Why is incorporating caring science into the nursing curriculum important? Well, incorporating caring science into nursing curricula is essential for reinstating the core values of compassion, dignity, and healing. Caring science, such as human caring theory, can emphasize self-compassion as a foundation for person-centered care. Finally, through reflective practices and experiential learning, caring science helps nursing students build a strong, values-driven professional identity and enhancing their resilience and empathy, which are both crucial to nursing practice. The human caring theory is the most appropriate caring theory for the HEU SON. Originally developed by Watson in 1979, human caring theory supports the development of meaningful relationships and enriches the nursing curriculum. In nursing education, this theory emphasizes fostering authentic connections between educators and students, supporting emotional and intellectual growth while honoring each individual's dignity. The 10 Caritas processes offer a framework for practicing loving kindness, compassion, and holistic presence. These processes guide nurses and educators to create a caring, healing environment and bridge didactic learning with clinical practice using enriched teaching methods and promoting relational and reflective learning. Upon evaluation, it is evident that the HEU SON does incorporate caring science into their curriculum, but there is potential for further development and improvement. 2 examples of how HEU SON incorporates caring science into their curriculum include their core values and some of the select courses' focuses. There are multiple ways for the HEU SON to further incorporate human caring theory. However, for this presentation, we will focus on 3 specific options. First, relational emancipatory pedagogy emphasizes caring relationships, critical dialogue, and reflection, fostering a caring culture. This approach transforms learning by helping individuals derive meaning from their experiences and develop a personal knowledge. Next, Adaptive education involves personalized teaching strategies that cater to the individual learner's unique needs and abilities, promoting an inclusive and equitable learning environment. Finally, reflective journaling can help students process complex emotions and connect with their values and beliefs. This practice fosters compassion, resilience, and mindfulness, which are all essential for professional practice. While multiple avenues exist for further incorporation for human caring theory to improve the HEU SON curriculum, the focus must remain on the student's well-being, personal development, and professional growth in a caring environment.
In conclusion, as with most things, Higher Education University's School of Nursing has both strengths and weaknesses. Driven by a holistic mission and supported by strong values, the framework offers a solid foundation for the program as a whole. While students and community stakeholders benefit from the program, updates are necessary. Curriculum revision is needed and should continue every 5 years per CCNE recommendation. More frequent revision will ensure students are being challenged and educated according to current concepts and standards. With caring and relationships woven into its design, Higher Education University's School of Nursing will continue to empower students toward provision and quality nursing care. Thank you for taking the time to review our curriculum design evaluation.